Welcome to Harmony Fire Department's presentation, Emergency Medical Services, the History of EMS in the U.S., Past, Present, and Future. The roots of EMS can be traced back to the 1700s, where treatment on the battlefield and extrication methods were being perfected. The military has made countless contributions to EMS, including triage, the treatment of trauma, and extrication from the battlefield. Ambulances of the 1800s included horse-drawn carriages. This yielded to the beginning of motorized transportation. The United States military rose to the challenges of the Korean War, where they treated and evacuated patients from the battlefield utilizing helicopters. The first civilian hospital-based medical helicopter program in the U.S. began in 1972, Flight for Life, Colorado, at St. Anthony Central Hospital in Denver. In the 1960s, approximately 50% of the country's ambulance services were provided by 12,000 morticians, mainly because their vehicles could accommodate transportation on a litter or a cot. Ambulances of the 1960s were staffed with attendants who were trained in advanced first aid at best, but this was about to change. During the 1960s, physicians understood the value of early intervention, treatment, and transport, especially of patients experiencing cardiac and neurological events. However, the ambulances of the time were only staffed with advanced first aid level responders at best, but this was about to change. If you know about somebody whose life was saved with CPR, you can thank Dr. Peter Safar, Dr. James Elam, and Dr. Archer Gordon, who proved that mouth-to-mouth CPR was effective in 1957. They went on to educate healthcare professionals and the public. In 1967, Dr. Peter Safar began training unemployed African men. Freedom House Ambulance Service was the first EMT squadron in the United States, and Pittsburgh's branch of Freedom House was credited as the first EMT trainees in the United States. Throughout the 50s, 60s, and into the 70s, the United States military continued to influence modern EMS. During the Vietnam War, tenets such as the treatment should start at the patient's side, the use of several medical devices, and concepts such as use of the helicopter are still in place today. In 1966, Accidental Death and Disability, the Neglected Disease of Modern Society, was published by the National Academy of Sciences, National Research Council Committees on Trauma and Shock. The paper concluded that in 1965, 52 million accidents occurred, killing 107,000, temporarily disabling over 10 million, and permanently impairing 400,000 American citizens at a cost of approximately $18 billion. Research that was utilized to develop what is now known as the white papers concluded that standards to which ambulance services were held were diverse and often low, and most ambulances used in this country were unsuitable, had incomplete equipment, carried inadequate supplies, and were manned by untrained attendants. Under the umbrella of the National Highway Traffic Safety Administration, EMS was undergoing a change. There would be increased funding and increased standards, including equipment, communication, organizational, and educational standards. By 1968, EMS was undergoing a change for the better. Now the public needed easy access to those resources. On January 12, 1968, AT&T announced the adoption of the Bell system of 911 as the nationwide emergency telephone number. On February 16, 1968, Alabama Senator Rankin Fight made the first 911 call in the United States in Haleyville, Alabama. Advancements in communications and telecommunications later led to enhanced 911 and the cell phone. The public was able to call 911 from their cell phone, and today, in some states, are able to text 911 from their cell phone. In the 1960s, there were ambulances that could get patients to the hospital very quickly. However, physicians became concerned about the lack of actual medical care being given, especially to coronary patients during emergency transport to the hospital, because they could benefit from that care. In 1969, while serving as president of the Los Angeles chapter of the American Heart Association, Dr. Walter Graf created a mobile critical care unit consisting of a Chevy van, registered nurse, and a portable defibrillator. Ambulances of the 1970s included the hearse and van style. Sometimes departments converted old delivery trucks into ambulances. Ambulances of the time would undergo a change, and that change had little to do with what the ambulance looked like on the outside, and more to do with engineered safety controls, diagnostic equipment, medication, and devices which would be added to the ambulance in an effort to enable providers to treat the patient en route to the hospital and keep them safe while doing so. On July 15, 1970, the Whitworth-Townsend Paramedic Act of 1970 was signed into law by then California Governor Ronald Reagan. Paramedic training began the next month at the Freeman Memorial Hospital under Dr. Graff's direction. It was the first nationally accredited paramedic training program in the United States. The National Registry of Emergency Medical Technicians is a certifying body in the United States for EMTs and paramedics. In 1971, 1,520 personnel took the first NREMT ambulance exam, and in 1972, the first NREMT paramedic exam was administered in Minneapolis. There was no reality television in 1972. However, the American public was introduced to the paramedic with the TV hit series Emergency, starring Randolph Mantooth and Kevin Tighe, two paramedic firefighters from Los Angeles Fire Department's elite Squad 51 paramedic intercept unit. Characters Roy DeSoto and Johnny Gage responded to emergencies and treated patients at their side, utilizing medication and state-of-the-art portable diagnostic equipment of the time. The Blue Star of Life is displayed on all licensed ambulances in the United States. It was created by EMS Branch Chief Leo Schwartz of the National Highway Traffic Safety Administration and trademarked on February 1st, 1977. It replaced its predecessor, the Red Cross on white background. Advances in ambulance design gave way to the Type 1 and Type 2 ambulance. However, the greatest advancements were inside. Ambulances of today have diagnostic equipment, medical devices, and medications, all designed to keep the patient safe, keep the EMTs and paramedics safe, and to provide the most positive patient outcome. Today, EMTs and paramedics are trained and educated to provide EMS in sometimes unpredictable environments. Critical care aeronautical EMS services provide critical care transport either from scene to the hospital or inter-facility via a fixed-wing or rotary-wing aircraft. Hospital-based critical care teams may be deployed to transport and care for critically injured or ill adults or children. These specialized ambulances are staffed with highly trained and educated paramedics, nurses, physicians, and other members of the healthcare team who provide critical care. EMS services in Rhode Island are licensed to provide ambulance services by the Rhode Island Department of Health. They must adhere to strict guidelines, including medical direction, ambulance design and construction, equipment par levels, medical devices, their calibration and certification, medication quantity, safety standards, documentation and communication standards, and EMS team configuration standards. EMT and paramedic candidates seeking a license to practice EMS in Rhode Island must first complete certification requirements set forth by the NREMT. Education and training requirements are based upon the level of certification a candidate wishes to pursue. Candidates are required to achieve certification at the EMT level prior to moving on to the advanced life support level certifications. Once EMS candidates in Rhode Island have earned national certification through the NREMT, they may petition the state of Rhode Island to become licensed to practice medicine by the Rhode Island Department of Health. EMTs and paramedics in the state of Rhode Island practice under the Rhode Island statewide emergency medical services protocols. Their oversight is given by a medical director who is a board-certified emergency medicine physician and/or a board-certified EMS physician. Paramedics and EMTs may consult with an emergency physician at any time that is necessary via phone. There is little in EMS history more important than the relationship of EMS with the community it serves. If you have opportunities, take classes in CPR and first aid. Get involved. And if you see an emergency unfolding in front of you, dial 911 immediately. This concludes our presentation. We hope you have enjoyed the show.